Hey guys, I'm Mrs. I. I'm going to be reviewing abdominal assessment with you. So starting with privacy, obviously when you go through your wipes and stuff, you want to maintain privacy during this. You see how I have the gown pulled up, but I also have the sheet up covering the lower extremities and the genitalia. We're just looking at the abdomen. So when we look at an abdomen, we want to look at the size, the shape, so the contour. Is it flat? Is it overly rounded? What does that contour shape look like to you? And symmetry, is it the same on both sides, or am I seeing an abnormal shape, kind of a bulge come up on one side or on the other? Looking at skin conditions, is there any bulges, masses, or lesions on the surface of the abdomen, which I'm not seeing in this patient? Looking at hair distribution, is the hair fine? Is it evenly distributed, or am I seeing that it's very shiny? There's areas of no hair. Those would be abnormal findings. Looking at abdominal movement, abnormals or expected findings would be pulsation, because we have the abdominal aorta located here in the midline, kind of on top of the umbilicus area. Your abdominal aorta lives there, so we would expect to find those pulsations when the patient's laying still. And then an abnormal finding would be peristalsis, or in a very small framed cachectic patient, you might be able to see actual like movement of the large intestine that would be indicative of a peristalsis. All right, now looking at the umbilicus. We're looking at the umbilicus. Is it inverted, everted, or is it midline? So inverted is in that it's pushed in to the abdomen. It kind of creates a little crater, and everted means that it's an outie, so it's sticking out of the abdomen, but still would be normal. And is the umbilicus within the midline? If we draw a line through the patient in half, is it in line with the sternum and the midline? Then we are going into auscultation. You always want to auscultate the abdomen before you palpate the abdomen, because you can abnormally kind of disturb your bowel sounds, and you want to preserve them. So we're going to listen first before we palpate. So when we listen, we're listening for the presence of bowel sounds in 4 quadrants. So if I would draw 2 lines through the umbilicus, up through the midline. So there's one directional landmark, the midline, and then I'd go through the umbilicus on the other side. I'm just making a big, like a tic-tac-toe board, but just using 2 lines, creating 4 quarters. And so we're looking at presence of the bowel sounds. An abnormal finding of the bowel sounds would be that their bowel sounds wouldn't be there. If you don't hear a bowel sound in a quadrant, you listen for another 4 minutes to confirm the lack of a bowel sound. So I'm gonna listen in the right lower quadrant, the right upper quadrant, the left upper quadrant, and I'm gonna listen to the left lower quadrant. I'm gonna expect that the bowel sounds are gurgling or like clicking sounds. That's what would be expected for the character of the bowel sound. And frequency is we want 5 to 30 bowel sounds per minute, but you're gonna listen for 1 minute in each quadrant. Like I said, if you don't hear it within the first minute, you have to listen for another 4 minutes to confirm, total of 5 minutes to confirm no bowel sounds in that quadrant. Then we move into palpation, so using our hands. When we palpate, we're doing light palpation, not deep palpation. So light palpation is only one hand. You're gonna make note, is the abdomen soft to palpation? Is it soft to push on, or is it hard? Is it non-tender? We don't want it to hurt. If it's tender, that's an abnormal finding. If the patient is guarding, or if the patient says, ow, that hurts, then you note what area you push to be tender. non-distended. So if you are pushing on the abdomen, it should be pretty squishy, for lack of a better term. If it's harder or distended, like if you're pushing on a balloon, then you're gonna note that to be distended. And then if it's hard, tender, distended, muscle resistance, where it's that guarding, they're protecting it, or if you feel any masses, any abnormal bumps or lumps that should not be there in the 4 quadrants, those are all abnormal findings. You'd ask the patient about when was the last time you urinated, when was the last time you had stool, and when was the, have you had any emesis, or have you had any nausea or vomiting? If they say yes, then you can go into greater detail about what did that look like. You know, is there pain that goes alongside of that? You could also ask how their appetite has been going. Have they lost weight recently, expected or unexpected? Ask them if they have any digestive issues, if they've had any reflux, if they've had any diarrhea. There's all sorts of digestive things that could be going on if they have a history of digestive issues. And then any chewing or swallowing difficulties, you would also ask them within your abdominal assessment. And that's the end of the abdominal assessment.